stems from genetic mutations, hereditary factors, environmental exposures, and lifestyle choices. It is a growing concern in the country. In urban India, it ranks as the second leading cause of death amongst adults, and in rural areas, it claims the fourth spot. But the battle against cancer is not just fought in the cells. It's a war that takes a heavy toll on wallets and hearts alike. The out-of-pocket expenditure is 3 times higher for private inpatient care, pushing desperate patients to sell their possessions or borrow from friends and family. The problem of cancer is only growing. Cases are projected to surge to approximately 15.7 lakh by 2025 compared to 13.9 lakh in 2020. Amongst Indian women, breast, cervical and ovarian cancers dominate, while Indian men battle mouth, lung and prostate cancer. Some statistics to better understand India's burden. Breast cancer accounts for over 25% of all female cancer cases, closely followed by cervical cancer that accounts for 18% of all cases. Oral cancer is the most common cancer amongst Indian men. India also holds the unfortunate title of being the global hub for oral cancer, accounting for over 30% of cases worldwide, mainly due to reasons such as the country's widespread use of smokeless tobacco like gutka. Lung cancer, linked to factors such as tobacco use and pollution, accounts for nearly 6% of all cancer cases in India and is expected to increase 7-fold by 2025 compared to a decade ago. Late diagnosis worsens the situation. For example, survival rates for breast cancer are at 68%, significantly lower than the global average of 84%. Cervical cancer claims the lives of nearly 2 out of 3 patients due to delayed detection. Additionally, almost half of lung cancer cases are diagnosed after it has spread, while the majority of prostate cancers are detected at advanced stages. India is also witnessing a distressing trend of cancer diagnosis occurring at younger ages, trailing behind countries like the UK, US and China. Disparities in healthcare guidelines such as PSA guidelines or screening tests further compound the issue, demanding the need for tailored approaches for cancer screening and awareness programs specifically designed for the Indian population. Today, we have with us renowned oncologists, Dr. Sewanti Limaye and Dr. Senthil Rajappa, to navigate the critical questions surrounding India's mounting cancer burden and how best to prepare for the challenges ahead. Welcome to the show.
One of the largest factors responsible is something called epidemiological transition, which just means we are living longer.
Stress is associated with tobacco use, with alcohol consumption, with drug abuse and things like that, which end up increasing your susceptibility.
I think it's a no-brainer that girls in their early teenage, between 9 and 12, should get vaccinated. You are seeing lung cancers in non-smokers, and it is almost going to be an epidemic.
Half of all patients with stage 3 lung cancer can now be cured.
Well, Dr. Limaye, let's start with you. Can you just detail to us what are the primary factors contributing to the rising incidences of cancer in India?
Thank you so much, Ekta, for having me for this show. As we have studied and published, there is a very nice review published in the Journal of Global Oncology, which tries to study why there is an incidence rise of cancers in India. And one of the largest factors responsible is something called epidemiological transition, which just means we are living longer, we are managing our chronic diseases better, and we are living to a stage where cancer becomes a common ailment. When we age, our cells mutate, break, and the cancer development can then happen. The median age where we are expecting to see cancers are around 65, and as our community ages, we can expect to find more cancers. The other reason to find more incidence of cancer, or rising incidence of cancer in India, is also the fact that we are more data capturing. We are forming registers, we are screening patients, we are capturing these incidences much more than we used to because of rising awareness. So I think it's multifactorial, but of course, the fact that we are managing our population tiny bit better is also accountable for the rising incidence.
Okay. Well, Dr. Rajappa, let's break up the incidences of cancer gender-wise. Let's start with men. What is the reason for the high incidence of oral, lung, and prostate cancer in men?
Okay, I think easy is to take the prostate cancer. One of the screening tests for prostate cancer is called the PSA test. PSA stands for prostate-specific antigen. It's a test that is done on the blood. Today, every other master health checkup ends up having PSA as one of their tests. So when you do a PSA, either in an asymptomatic elderly man, or if you're doing it because he has some discomfort or problems passing urine, you tend to pick up this. So for me, the most important reason why the incidence of prostate cancer is going up is because we are doing more PSA tests. And when you do more PSA tests and you find an elevated PSA, you tend to then cascade that gentleman down a series of tests, which will then prove or disprove the presence or absence of prostate cancer. So that is probably the most important one, because there is no clear association between diet, lifestyle, and all of these things as far as prostate cancer incidence is concerned. When it comes to oral cancer and lung cancer, you can put them together as the most important tobacco-related cancers. Now, whether you're chewing tobacco or you're smoking tobacco, it impacts the incidence of oral and lung cancer. Though the incidence of both smoked and non-smoked tobacco consumption is going down in this country, what we are seeing now is a reflection of what all of us have been doing in the past couple of decades. Because what you did in the late 90s and the early part of the century is what is being reflected as a higher incidence or a rising incidence of these cancers. So for me, the increased consumption of tobacco in the last part of the previous century and the beginning of this century is probably the most important reason for the rise of these two cancers, and of course, environmental pollution and so on and so forth.
Okay. Well, Dr. Limaye, the same question about women, because we have breast, cervical, and ovarian, which is dominating. Why?
So for breast and ovary, we know that we are dealing with hormonally driven cancers mostly. If you look at that, changing lifestyle, westernization, less physical activity, changing hormonal levels for women who are delaying the pregnancies, increment in the menstrual age, exposure to the woman with the changing levels of the hormone much more than we saw earlier, obesity, intake of alcohol, increment in intake of alcohol, all of that amounts to increase causation of breast cancer or even ovarian cancer. Of course, then there are better diagnostic techniques that are in play. Early screening, because of rising awareness of some of these cancers, specifically breast cancer. There is a national drive in trying to increase the awareness for breast cancer screening. And so all of that, of course, adds to the numbers that we finally get. But there is a real increment in the numbers, and that happens because of the X number of factors that I mentioned. For cervix cancer, I will say in particular, we are trying to decrease the rates. The screening numbers have gone up. We used to be the topmost country for cervix cancer, but that has been tackled to a great extent. Having said that, there's still cervix cancer that connects with low socioeconomic strata, with lack of awareness, with lack of screening, locally advanced disease at diagnosis, and hence capturing of cervix at a locally advanced or advanced stage where it leads to higher mortality is still a big problem for India, and it calls for more awareness for all these three cancers.
So would you recommend the cervical cancer vaccine?
Absolutely, 200%. As a professional sitting on the other side of the table, if there is any measure that can prevent the cancer from happening, be it cervix or any other malignancy, I would absolutely recommend. But with the Indian government coming in with the collaborative effort with Serum Institute of India and the cervix cancer vaccine being launched in India at a very affordable price, I think it's a no-brainer that girls in their early teenage, between 9 and 12, should get vaccinated. Even up to 26, they say the benefit from vaccination is complete, and the vaccination can still be taken up to 45 years of age. So it is something that can really prevent cervix cancer from happening, and we should all raise the awareness around this and be up in the arms and vaccinate our young girls and also boys for that matter.
Dr. Rajappa, you know, there's this rising incidence of cancer. How much of it is because of lifestyle and how much of it is because of stress, according to you?
Okay, I think stress is the easier question to answer. I don't think stress has been directly related to a higher incidence of cancer. Then most of us doctors should end up having some kind of cancer or not. Certainly oncologists for that matter. So stress is not directly, but stress is associated with tobacco use, with alcohol consumption, with, drug abuse and things like that, which end up increasing your susceptibility. So stress as a factor does not directly impact. Lifestyle-related cancers are many. Again, Dr. Sewanti very nicely elucidated or elaborated them during her answer regarding breast cancer. So breast, ovary, uterus, some of the gastrointestinal cancers, these are all very much related to lifestyle, obesity, smoking, alcohol, inadequate activity, and so on and so forth. So yes, if you have a sedentary bad lifestyle, your probability of developing one of these cancers is going to be certainly high.
Okay. Well, Dr. Limaye, lung cancer incidence are expected to rise by around 5 to 7 times in the next couple of years. We know tobacco is a reason for that. But how much of a reason is, say, air pollution?
Huge. I think in India, we are realizing that 50% of a particular type of, the commonest type of lung cancer, 50% of that type is actually driver mutation driven, which means it's a non-smoker's cancer, which means that there is an insult happening to the human body from somewhere that is leading to this cancer causation or cancerous changes in the body. And if you look at the recent data that was presented at ESMO 2023 by a group of researchers in the UK, it showed that a particulate matter of 2.5 micron in size and over that size was actually directly responsible for a particular type of non-smokers lung cancer called EGFR positive lung cancer, which is seen in nearly 25% of adenocarcinomas of lung in India. So if you look at that, and yes, it is a single major study and it needs to be duplicated and all of that. But if you really see the amount of pollution we are all facing on a day-to-day basis, and just to give you a context, 2.5 micron, the regular size of the particulate matter that we face every day is 10 micron. So if you have that kind of exposure happening, even if you're a non-smoker, every day you are being exposed right from birth to levels of injury that are like smoking cigarettes, even as you grow as a child. So you are seeing younger lung cancers, you are seeing lung cancers in non-smokers, and it is almost going to be an epidemic. If you look at the numbers, it's going to be an epidemic. So it's high time we figured out prevention strategies, not only for smokers, but also for non-smokers. And when we talk about air pollution, we talk about going out and, running in nature. And when I tell my patients, I'm thinking about all the pollution that is out there on the bridge when they go for their morning run. So we have to be very mindful of all that and really also be mindful of the smog level and when to expose yourself to that kind of injury as we go along in our routine lives, and to be aware and screen.
Okay. Lots of younger people are also getting cancer. One of the reasons, as Dr. Rajappa had earlier told me before the show began, is because of the population, and we have a younger size of population. So that could be one of the reasons. But is there a susceptibility also that India has, which is resulting in younger people getting cancer? You mentioned air pollution, younger people come with incidence of lung cancer. Could that be correlated?
Ekta, we are largely deficient as a country in understanding the epidemiological transition of cancer. we are really deficient in studying what are the epidemiological factors contributing to younger presentation of cancer. We are doing a lot of work in this area, but we are still largely deficient. If you look at lung cancers, I gave you a reason, but there may be similar reasons for breast cancer happening in younger population, non-hormone positive breast cancer is happening in a younger population. Triple negative breast cancer in India happens at least 10 years younger, in 10 years younger women than what you see in the West. So a lot of this, I believe, is coming as a contribution from pollution, but which pollution? What pollution are we talking about? What is the exact cause? We haven't nailed it yet, and there's much work that is required in this area.
The other thing is, when it comes to cancer in India, is the low survival rates. It stands at around 30% of India's cancer patients survive for over 5 years, and almost 50% of cancer is seen in late stages in India. Is that primarily because of a late diagnosis?
I would say yes, primarily yes, because we have such poor screening rates. We have complete lack of awareness. We have extremely poor screening rates. We as a nation don't screen. And I'm not talking about screening of the poor. When we talk about screening, we talk about these vans where we are running camps and we are bringing in people for free screening. I'm talking about screening of regular people. Just think around yourself. Each one of us, 3 of us are here right now. Think around yourself. Is your family screening? Are your friends screening? We as a nation just don't screen. So we end up with late diagnosis. We end up with more advanced diseases, and we know that advanced diseases are linked with death and dying.
But Dr. Limaye, there are many cancers which cannot be diagnosed or are undetectable. There are lack of symptoms. For example, pancreatic cancer, lung cancer, cervical to a certain extent, ovarian, colon. What does one do in that case?
So there is a lot of work happening now with what I call new age diagnostics. So we are looking at the tip of the iceberg with the screening tools, and I think the real promise lies in figuring out cancers with the new age diagnostic techniques, whether it be AI-based chest X-ray to figure out lung cancer, or whether it be a blood test to figure out the presence of cancer in the body, or whether it be a urine test to figure out the presence of cancer in the bladder. All these techniques are really coming through. There's a body of work happening with great force. I see great promise in it. I was part of such research efforts from India, and I really feel that's the answer to the world. We just had a major publication as a cancer community in New England Journal of Medicine, where we saw a blood test diagnosing colon cancer. Similarly, we already are aware of a blood test that was presented by Johns Hopkins that could pick up 4 cancers. We are aware of GRAIL as a technique with Gallery as a test, which can predict a certain group of cancers in 40% of people.
Well, Dr. Rajappa, what does one need to be aware of in terms of symptoms when it comes to cancers which are difficult to detect?
I don't think there is one specific symptom can help you to straight away make a diagnosis of cancer. You need to be aware of those warning signs that are displayed, all over, especially in the vans that we just discussed earlier. Change of voice, an ulcer in the mouth that is not healing, especially if you're a tobacco chewer, a cough that is not going away, finding blood in your spit, a mole that is enlarging in size, painful or bleeding, any change in your bowel habits as you're growing older. So these are some of the warning signs of cancer, as they would say. But remember that these are not specific for cancer. You grow older and you get any of these symptoms, and it's not getting better with the general remedies that you would take. Let's say you have a constipation, you would take a laxative, you would modify your diet and get on. But if it's not getting better in a few weeks' time, I think you should see a physician to get a colonoscopy done. If your cough is not getting better, with the usual things that we do, you should go and get a test done. So I don't think we should sit on these symptoms because there's nothing pathognomonic or 100% specific for cancer. Anything can be a sign of cancer. Some are non-specific, just feeling tired, having weight loss, not having good appetite. Tuberculosis can also have the same symptoms. So you can't be saying, I probably have tuberculosis, I don't have cancer, I don't need to be tested. Whether it's tuberculosis or cancer, it needs to be ultimately tested. So I don't think we should wait for one particular symptom to come. Anything that's coming on is not getting better, and you need to be tested to find out if it's not cancer, what else is it that's going on that's causing this problem.